This is lateral air transfer device training. Prior to using any equipment, always perform a safety check, taking it out of service if necessary. Always use at least 2 caregivers, and the air transfer device is used when a patient cannot transfer themselves from one surface to another. Use a surgical drape if gross contamination or soiling is likely. Roll belts and transfer straps under the mat. The PAL pillow arm leg roll can be done to ensure easy placement of the mat. Tuck the folded side of the mat under the patient. After the mat is placed, turn the patient to the opposite side and carefully unroll the mat, taking care to not damage patient's skin, especially when unrolling straps from the mat. You can ensure the patient is properly centered on the mat by lifting the loops at the head and the foot and ensuring that the patient is centered between the loops, as demonstrated here. Fasten both sets of belts for patient comfort, leaving loose enough to allow for inflation of the mat. Close the flap for the hose opening that will not be used during the transfer, ensuring that the sock for the hose is securely closed under the flap. Insert the hose in the opposite opening and wrap the strap around the hose, ensuring the Velcro fastening and hose are secured by tugging lightly on the hose. You can use the safety icons located on the flaps as demonstrated here as a checklist to guarantee that all steps have been completed, thus ensuring patient and employee safety during the transfer. Bring the 2 surfaces together for the transfer and ensure all brakes are set. Outer side rails on beds and gurneys should be up for the transfer. Both surfaces should be level, with the receiving surface slightly lower than the transfer surface. In areas such as OR and radiology, this may require you to raise the gurney or bed in order to have the receiving surface lower. Turn on the blower and inflate the mat. In some instances, such as a patient with a hip fracture, it may be helpful to guide inflation of the mat by applying pressure with your hand to the mat as it's inflating. Hold the extended pull handles and gently, slowly pull the patient towards you. In some instances of limited space, this may require you to start the patient transfer, stop, and reposition your hands on the straps in order to safely complete the transfer. Reposition the patient on the receiving surface prior to turning off the blower. Remove the hose and open both flats to aid in deflation. Always make sure the mat is deflated before separating the 2 surfaces. Log roll the patient and remove the mat when it is no longer needed. In areas such as the emergency department, you may leave the mat under the patient if they are likely to be admitted. Proper assessment, triage, and use of the mat in the ED will assist other departments in the hospital the patient may be transferred to. For patients going to OR, the mat may be left under the patient to assist in the transfer to and from the OR table and assist in patient repositioning in PACU, and then assist in the transfer once the patient is returned to their sending unit. Don't forget to review your hospital's policy on the use of air transfer devices and complete your competency checklist. Thank you for completing this training.